weight, his weight is not adequate. One of the complaints that you can meet easily in the clinic, and it represents another 1/3 in the pediatric practice. Some of them is true, and some others are misconcepted. So when you evaluate, you have two answers. One of them, I'm sorry you are wrong, the growth of your child is okay, no need for interference, and she will go ahead for another treatment. Or, yes, you are true, there is a problem, and we want to solve this problem. My clinical advice and the practical advice, when the complaint of failure to thrive is presented to you, even before taking a history or doing any examination, take a growth chart from your office, show it to the mother, and say, how old is your child? And she is going to say, yes. And you show her on the growth chart what is expected as normal at that age, before taking the weight, before taking the history, before doing any examination. And this will be very convincing, but starting to examine and say, we have expected 13 kilograms and your child is 15. So I don't know what you are here today. What's failure to thrive? They used to use the term growth failure. Nowadays there is no place in the literature for the terminology growth failure. We use the terminology failure to thrive. This is because in severe forms of growth failure, development is affected as well. And using the terminology growth failure made the pediatricians omitting, missing, neglecting the developmental aspect of delay. So, failure to thrive can be categorized under one of three categories: inadequate intake of calories, excessive caloric losses, or inadequate caloric absorption. And this infant was seen at 6 months of age with marasmus. The infant was born to a mother who did not bond effectively by taking an adequate breastfeeding technique. Because of postpartum depression, he has evidence of severe wasting and neglectful care, as also evidenced by diaper excoriation. Weight gain was achieved only when he was given to his aunt. Change of the environment. Your objective in failure to thrive in mild forms is the growth parameters, weight and length. In severe forms of growth parameters, focus on the development, and the best measurement of this will be the skull circumference. When to diagnose? Is it a simple diagnosis like that? This is failure to thrive? No, we have 3 criteria. You should find one of them. At least one of them. Number 1, fall over 2 or more percentiles. I'm following him, and he's decreasing 2 centiles or more. Number 2, he is coming already below 3rd or 5th according to the percentiles we are using. Or having less than 80th centile of median weight for height or for length. If you find one of these 3, this is sufficient to say this is a case of failure to thrive. So the definition will be defective growth in weight and length, as well as assessment of the development. Do not forget the development milestones. Do not forget to assess the milestones. And because one of the very important areas that are missed from the pediatrician is the neglect point of view, socio and the psychosocial aspects of care, the American Academy of Pediatrics with the American Academy of Pediatric Committee on Child Abuse and Neglect, they sit together and they formulated the definition of neglect. Neglect has one of three definitions. Intentional withholding of food. She keeps the food, she decreases the food. This is either on social basis, this is either on money basis, economic basis, something like that. Strong beliefs in regimens that jeopardize a child, and it's very famous to meet mothers doing a macrobiotic diet. You know the macrobiotic diet? They have a special pyramid of feeding different from our orthodox medicine. In our orthodox medicine, there is a pyramid of food in which everything has its calibers and its amount. But in macrobiotic, they consider milk as a poison, not in allergic persons, in general. They consider taking milk is a catastrophe. So, this strong belief in this regimen, if it's settled in the mind of this mother, she's going to hurt her child from the nutritional point of view because of this, and this is calculated as neglect. The third point that is neglect, family resistance to recommended interventions. When she comes, when she go, and you give the advices, they are not applying the advices, in spite they are rational and applicable. You can judge this case is a case of neglect. In our country, we don't have a punishment for the neglect. But in some countries, this child can be taken from their parents. Mortality and morbidity from failure to thrive is related to their nutritional deficiencies. Before leaving this, you may ask a very famous question after this stage of the talk. What is protein energy malnutrition and where is its place in this talk? Marasmus, kwashiorkor, and blah blah blah. This is one of the sectors of failure to thrive in which intake of the food is the problem. But failure to thrive is a broader terminology. So, failure to thrive might be due to neglect, might be due to deficient intake, whether it is in amount or quality of the food, this is malnutrition, or due to maldigestion. And the best example of maldigestion is cystic fibrosis disease. This is more common. But in our countries, parasitic infestations, especially giardiasis, is very common, and it causes a great extent of maldigestion. You know that in Egypt, one of the studies demonstrated that giardiasis is present in 35% of the population. Very common infestation. Malabsorption syndrome, whether it is due to pancreatic disease, due to intestinal disease, due to liver disease, intestinal disease due to mucosal pathology, congenital affection, enzymatic deficiencies. We have a very big list of malabsorption. Hypercatabolic states like in febrile diseases, those with fever of unknown origin, those with malignancy, those will be in this sector hypercatabolic state. Increased losses like those with excessive strenuous exercises having this activity, in ADHD persons who are wandering all the day and climbing among the walls, this will lead to excessive losses. Here I grouped the history and examination in lists, and you can take this to make it as your guide during examination of a failure to thrive. Take a good maternal medical history in details, including age, gravity, parity, abortions, and so on and so. Take a neonatal medical history, including gestational age, IUGR, Apgar score, anthropometric measurements at birth. Infants of child's history, focus on medical-based history to exclude medical disease. Feeding and nutritional, I am going to focus on this. growth and developmental progress. Postnatal medical history includes immunization, allergies, medications, intolerances, and so and so. The history of food intake will settle on the following: dietary details and the feeding behavior. There is a difference. Dietary means the food itself. Feeding means the process of feeding. So, dietary details: milk, formula, solids, vitamins, supplements, food allergy, intolerances. Feeding: suckling, chewing, swallowing. This is the feeding process itself. Caregiver knowledge: that you should take the caregiver knowledge. What is the concept in the mind of this mother? What she is understanding about nutrition. So, sometimes a very obese mother comes to you saying, my child is not eating well, and the weight is okay. And then you ask her, what do you think the recommended food for him? And she will say, I expect him to eat a dish like that, and a part like that, portions that are not suitable for his age, and this is misconception. Then just we improve this for him. If you didn't mention the normal findings, as we mentioned at the starting of this talk, she will not believe you. She will consider you that you don't want to treat this child. Basic food and nutritional needs available or not. You should know from where they get their money. Is their money sufficient or not? Is there any supplementation or subsidization in their family? And so and so. Nutritional ignorance is very important. You should trace it. And I advise you, as pediatricians, to take lessons in food preparation and food industry. And myself, I took a training in this. And I gave great advices to persons based on Abla Nazir. This is because many things are going wrong in preparation of food. Steaming or boiling, blending in a glass blender or in a plastic blender. And in cases with plastic blender, it has negative charges, and most of the water-soluble vitamins are positively charged. They will attach at the wall. You are going to empty the food from its water-soluble vitamins, and so and so. You should know the ways to perform good advice. Psychosocial history, including finances, environment, caregiver identity and responsibility. Is the father responsible? Is the mother responsible? Is the mother coming complaining that they don't know the mother, although they are 3 years? This is identity. Daycare use, beliefs about child reading, history of abuse or neglect, prior child with growth problems, family substance abuse, and I focus here that child abuse and drug addiction in parents are very common but commonly not reported. Take care of this. When a violence, you see the blow on the face of the mother, and she will say, while I was asleep, I was hit by the wall, and this is a boxer action by the violent husband, and you can expect other abuse, physical abuse. Maternal postpartum depression, take care of it. Educational level of caregivers, employment, transportation, welfare, health insurance, all this should be reported. What's your impression after this very big list? That you can take only 3 to 4 cases of failure to thrive in your clinic per day. Per week? So, the habit of taking these cases like those with acute follicular tonsillitis, finishing them in 5 minutes, you will not reach the diagnosis, never ever. Physical examination, you take any disease, usually signs are not significant. Plotting growth chart at multiple readings, multiple points. Examine for other chromosomal diseases, metabolic disorders, with noting vital signs, general, skin hair, head, eyes, ears, mouth and pharynx, neck, very important, especially the facies and head. You can diagnose syndromic disorders that are missed. You can diagnose genetic diseases that are missed from a good examination of the head and neck. So, some points you should put in mind: abuse and neglect, cystic fibrosis, GERD, HIV, but not in our countries, growth hormone deficiency, keep it in mind. Laboratory studies are not usually needed. And initially screening should include the very simple following tests: stool, urine, liver, renal, and complete blood count. This is the basic. If these are within normal, mostly this person needs time to discuss more than medicine to give. Other additional testing will be reserved for special conditions, and during the algorithm I'm going to mention some of these problems. Imaging, usually we don't need, except if there is neurologic abnormalities. We have imaging of the brain. How many cases you are going to diagnose as corpus callosal agenesis presenting with failure to thrive? Many cases. When you find some trivial, fine neurologic signs. Medical care. Number 1, observe the feeding process. You are going to say, I am a male and this is a woman, how to see her feeding. You are a pediatrician. Leave it if you cannot do it. She should feed in front of you. And feeding, giving the breast or giving the food in front of you. To notice child-parent conflict, perception of caregiver to this problem,
Hello.
feeding techniques, forceps.
Hello.
Then take 72 hours dietary recall. It was 24 hours before. It was changed last year. The recommendation last year is 72 hours dietary recall. Other dietary instructions: eliminate empty calories, being wahda, with one of the persons coming, mothers coming with a child who is failing to thrive, and saying he likes tomatoes, he likes carrots, he likes marrow. Most of these are empty calorie foods. Then skip your regular meals and snacks. Offer solids before liquids. Consider fortifying calories by adding oils. And adding oil should be after cooking. It shouldn't be boiled oil. It should be added as some drops on the different foods. Increase protein, but take care. Increasing protein more than expected may lead to the metabolic syndrome of obesity later in life. High protein intake in a failure to thrive, especially if he was low birth weight, is a common condition that yields obesity later in life. Provide support for the caregiver. We are not the enemy of the mothers, we are the friends of the mother. Psychosocial evaluation. Keep in touch with a psychiatrist, and sometimes you refer for. I remember one of the mothers who came to you frequently with wrong things that were not wrong. And I advised her to go to a psychiatrist. And 2 hours later, there was a struggle in the clinic outside and fighting. And the father came saying, "Are you saying that my wife is mad?" So the clinic was moving. And he took the fees and left. 6 months later, he came to apologize and say, "Now I am married. I was not before." Usually we don't have surgical care for failure to thrive, except very rarely with persons having something like adrenal, congenital adrenal hyperplasias or something like that. You need a team of nutritionists, developmental socialists, physical or occupational therapists, mental health professionals, and you may have an alternate who. Reporting to social affairs, not in our countries, but I think it will happen. Dietary adjustment. Is it an emergency? In severe forms, you need hospitalization, especially of those with vital signs affection. You should see him at least every 2 weeks and plot the charts of the growth charts regularly to know the tendency and so on. And if it is mild, prognosis is good. but if it is severe, do not miss the developmental delay that will happen later in life. So, if you see a weight gain problem below screening threshold, send your social worker, giving some advice. If he succeeded, okay. If not, send your nutritionist. If he succeeded, it's okay. If not, examine as a pediatrician. This is your role. Then if you succeeded, okay. If you did not succeed to improve this failure to thrive, you need a multidisciplinary team. And if succeeded, it's okay. If not, consider social and psychological evaluation of the family, not of the child. So, if the onset of failure to thrive is since birth with very low birth weight, or since birth was normal birth weight, or acquired after a few months he started to lose weight and getting failure to thrive. If he is since birth, you have two options: mild to moderate or severe. Mild to moderate, this is nutritionally manipulation. It can be manipulated by nutritional advices and care. If it is severe, these cases are going to prove to be severe forms of inborn errors of metabolism, syndromic pathologies, or congenital malabsorption syndrome. Being from the Middle East, we have, all of us are from the Middle East, we have tufting enteropathy. It's a very common cause of death and failure to thrive in our community. We diagnose about 50 cases a year. Tufting enteropathy, congenital malabsorption. If it is acquired, starting acquired, think in organic disease causing failure to thrive, or neglect as non-organic pathology. And this is the same to repeat. To sum up, failure to thrive is a common problem in our community. Although more than 2/3 are organic. Even in organic cases, non-organic concomitant problems are there. Take care of neglect. Take care of abuse. Pay time to assess. Use the growth curves and do not depend on your subjective impression. It's okay, I see he is growing well. No, what is the weight? Put it on the chart. What is the length? Put it on the chart. Share other specialties in your team. Do not work as the one-man show. Study some psychiatry to back up abnormal parents, and thank you.